And today we're looking at nursing home issues. And anyone who's been awake during the pandemic knows that there have been many issues with nursing homes, some of them that were just discussed. And today we're very, very fortunate to have my partner who's going to bring us into this conversation with the leaders of New York State consumer and provider issues. Aaron Connor, our managing partner.
Good morning, everyone. This session is the nursing home dilemma, providing safe, affordable care in the post-COVID world. We're fortunate to have with us Beth Finkel, the State Director for AARP, and Jim Clyne, President of LeadingAge. Beth Finkel leads the day-to-day operations for AARP New York, the most visible organization in the state advocating for New York's over 50 plus population with 6,000 volunteers and 2.5 million members. Beth and her team are very involved in legislative efforts to improve healthcare, prescription drug costs, retirement plan savings, and other issues. And as you'll hear today, AARP pushed hard for reforms in the state's nursing homes during the pandemic. For more than 25 years, Beth has published many white papers, served on Governor Cuomo's Office of Community Living Advisory Committee and Smart Commission, as well as Senator Jill LeBrand's Working Group for the Aging. Jim Clyne is president of LeadingAge. This firm has had a long relationship with LeadingAge, being in this forum. LeadingAge represents more than 4,000 members and employing 150,000 professionals in not-for-profit and continuing care communities, including nursing homes, senior housing, adult care facilities, and assisted living and community service providers. Prior to his role, Jim worked in state government, the health department, as executive deputy commissioner, and in the state assembly. So I believe Jim is going to start us off today. Welcome, Jim.
Thank you. Gonna maybe be just a little bit broader than the topic because the issues that we're facing in the world of long-term care go beyond the nursing home, and I'm going to cover just a little bit of the demographics, some of which has been talked about, but I think when you see the numbers, you'll understand what we're really facing now. The reality is that aging population is growing rapidly, and at the same time, the working age population is shrinking. Particularly the over 85 population is growing rapidly. This demographic is going to pose a huge problem, not just for nursing homes, but for home care providers, assisted living providers, everybody in the long-term care network. We can wish all we want to have workers come into long-term care, but the state actually has to do something about it. At the same time, the population in nursing homes, I think there's a great misconception about what's going on in nursing homes right now. What's not on the slide is right now, the long-term population, the average stay in a nursing home is now less than a year. But you can see from the statistics, the nursing home population is elderly with any number of comorbidities. And most importantly, I think there's a great underestimation of the amount of dementia that is in nursing home populations. A lot of times there's focus on dementia only units in nursing homes, but the reality is over half of all nursing home residents have a diagnosis of Alzheimer's disease or another form of dementia. Now, at the same time, New York has a very robust community program for long-term care. Right now, New York represents 11% of the nation's spending, which is almost twice what our population is. So people aren't in nursing homes right now because there aren't alternatives. People are in nursing homes in many cases because there is no other reasonable alternative for them to get care. The workforce pressures not only is a matter of demographics, but it's a matter of having the right people, the right skills. We've talked with the state labor department. They have shown some interest in creating more training opportunities to focus on home care and healthcare jobs. The reality is that's where the jobs are going to be in the future. And the state needs to pay more attention to that, because again, we can wish all we want to get people into nursing homes or other long-term care providers, but if you have a decrease in the graduation rate of nursing assistants, I don't know how that's going to be possible. The finances in long-term care, particularly in nursing homes, has been bad for the last 10 years. The cuts in the state budget have focused on nursing homes to a large degree. The nursing home rate has not had an adjustment since 2008. And a lot of people don't understand what happened during the pandemic, but in 2020, the state actually cut the Medicaid rate for nursing homes by 1.5%. So that while we're in the midst of a pandemic, faced with unbelievable costs for PPE, for staffing, the state, unlike 30 some odd other states that were increasing Medicaid reimbursement, the state was actually cutting reimbursement to nursing homes in the middle of the pandemic. Right now, the nursing home rate in New York State is, there was a recent study that analyzed 28 states, but it was the ones that were the largest and most consequential. And New York was the worst of all those states. The Medicaid rate falls $64 a day below what's actually needed. So the result of that is over the last 10 years, the state has created a system where not-for-profits and government facilities are going out of business. Already 50 have sold or closed since 2014. The reason that that's important, not that the only good providers are government programs or not-for-profits, but on average, government programs, government nursing homes and not-for-profit nursing homes staff better and have higher quality scores than the for-profits. So the state, whether consciously or unconsciously, is moving towards a system that's going to be dominated by for-profit providers. I just wanted to show this slide because it talks to what's going on in the state over the previous 10 years. When Governor Cuomo came in, he championed this MRT proposal where there was going to be this transformation of the healthcare system. There were going to be some cuts, but the state was going to get a federal waiver, and that money was going to be pumped into reforming the healthcare system. As you can see in these two charts, both the DSRIP money, which was the federal funds for the waiver, and the transformation grants that the state funded, were supposed to be the dollars that were going to drive reform. And you could see that the long-term care system, nursing homes, home care were not funded. There has been no investment into transforming the system. So the operating rate has been cut dramatically over the last 10 years because it's not kept with inflation, and there was a 1.5% cut during the pandemic. And at the same time, the state has starved the system for any capital reimbursement to make the transformations that were needed for a new kind of long-term care system. So then COVID hits. It's already a depleted system, one where it was already difficult to keep and retain staff. And as I said, the state does a cut in the middle of that. again, putting tremendous pressure on nursing homes and assisted living programs as they try and keep the most vulnerable people in New York State alive. And I think what we're seeing from a lot of the reports that are coming out now is that this blame the nursing home game that is going on, particularly in New York State, really bears no resemblance to the reality of what was going on. What we saw really was that COVID got into nursing homes and assisted living programs from the community. So as community rates went up, so did infection rates in nursing homes and assisted living, and had very little to do with the type of programs that were being run by the nursing home or by the assisted living. The one ray of hope that did come out of this was the federal government. The federal elected representatives stepped up and provided some reimbursement, some that went directly to nursing homes and some that came to the state, relieving some of the budget pressure on New York State. So we avoided some other cuts. But the reality is, on average, the amount of the losses that are being covered by the federal funds is only about 38%. So it's nowhere near what nursing homes needed in order to meet the pandemic. So what do we need to do? Why did I spend so much time on those couple of slides? Because the reality is, and a couple of speakers have already talked about this, is the funding system is broken for nursing homes. Could the state do a better job? Absolutely. The Medicaid reimbursement for nursing homes has been so politicized that it's been squeezed down to a ridiculous amount of money that can't possibly support the kind of quality care that the state is demanding. So the answer is to not rely on Medicaid as the payer for long-term care. Again, most seniors don't recognize this, and the public doesn't also, but Medicaid is the underpinning for the funding in nursing homes. It's 72% of care is funded by Medicaid. So when you're talking about nursing homes, you're really talking about Medicaid. Congressman Swazi is soon to introduce legislation, the WISH Act. It'll be the first, I think, serious discussion about funding for long-term care since the Class Act was included in the ACA, which was then unfortunately, bargained out of the ACA. Some states are starting to look at reforms and coming up with different ways of funding post-acute long-term care. The other thing the state needs to do is get a little bit more open into new models of care. And that sometimes means, again, some additional investments. Some of the more home-like settings, like the greenhouse model, is more expensive to construct. When the greenhouses were built for the Eddy in Cohoes, special legislation had to be passed to override the capital caps that the state had in place. So those beautiful facilities would never be there without special legislation that needed to get passed. The state needs to, if they want this type of model, needs to provide the reimbursement that will support the building of these kinds of services. And the state also needs to do, look at some other things that have just recently been done. For example, the recently passed legislation requiring a spending of 70% of all income on services for people in nursing homes, while well-meaning and probably something, if done correctly, we in the not-for-profit world could live with. will discourage any capital investment because capital is counted in this formula of the revenue. So if I decide to go to single bedded rooms, which would be better for infection control and privacy and overall quality of care, because of the formula that the state has implemented, it's going to require me to change my staffing substantially to hire more staff, which has nothing to do with a change in whether it's single room or double room. So again, the state, making a well-meaning proposal, but really going to choke off capital investment in nursing home. And finally, the state
Jim,
needs to look
Jim, you have
at
about 4 minutes left, Jim.
Yep, and the other thing is the state needs to look at other viable care models that are under the nursing home level. For example, the AARP program, allowing for some Medicaid funding for assisted living is something that would go a long way to creating a more equitable service model in New York State. So now I think Beth is going to take over and do her presentation.
Thank you very much, Jim. I think we all know that nursing homes were facing a lot of challenges pre-COVID, and during COVID, they faced new challenges and more expensive challenges, and funding is always going to be an issue, but we also have care that needs to be given, and I think Beth is going to give us the individual care perspective.
Hi, I think someone needs to turn my video back on, and I'm going to take over on the screen, so thank you so much. Okay, and I think we're going to be in business. All right, so first of all, thank you, Jim, great presentation. I particularly want to thank Lou, thank Beth for their work, and I just want to go back before I get started to something that Senator Serino said, and also something that Assemblyman McDonald said, which, Senator Serino was very clear about home and community-based care, also about long-term care ombudsman funding, and I'm going to get to that in a little bit. And I thought that when Assemblyman McDonald kept reiterating about keeping people in their homes. So I think everyone knows that AARP is the biggest, consumer group, 450 plus, looking at quality of care and how we can age in place. And clearly everything that happened during the pandemic really shined a huge spotlight on both our institutional care, but also on our home care. And this is our opportunity to come together with a new direction and figure out where we're going to go next and what we're going to do next. So I'm going to start going through my slides, but I want to make sure that everybody is clear on that. 40% of all deaths in this country from COVID occurred in nursing homes. And yet nursing home residents are less than 1% of all the population of the country. So we really need to keep that in mind as we're looking at this. So AARP looked at a 5-point nursing home reform plan, which, by the way, part of that is looking at home and community-based care. And I'm going to start off with the first one because we have to realize that what happened can absolutely never happen again. And that's where we need to go going forward. So first part was looking at quality care, and I don't want to read from this, but I think you can all get the gist of it. We need to make sure that nursing homes are spending more money on direct care and increasing their staffing levels. And the good news is that as Senator Serino and Assemblyman McDonald mentioned, the legislature absolutely took this up. And they looked at ongoing testing and adequate PPE. And they also looked at the long-term care ombudsman, which is what I mentioned previously. So here's the part that we have to think about. It was a step in the right direction. This was the bill the legislature past. It was Rivera Gunther. But here's what we have to keep in mind. It did not go far enough. What New York now says is that 70% of the revenue that comes in must be spent on direct care. But in New Jersey, their law requires 90% to be put for direct care. So that's really important to keep in mind. We got together with a group of other organizations, LongTerm Care Community Coalition, the Center for Elder Law and Justice, Metro Justice, Coalition of Institutional Aged and Disabled, and Community Service Society. And we asked for stronger standards. And I'm just going to go into the ones that are the most important, and we are not going to back down. We're going to keep working on this. We want to require nursing facilities to have at least one registered nurse provide 0.75 hours of care per resident per day, recognizing that increased RN staffing hours directly correlate to better quality outcomes. We also want a requirement that there needs to be a registered nurse in a nursing home facility 24/7. We want to make sure there's a requirement to maintain all nursing staff at 4.1 hours per day per resident. That's not where we've come so far. And that is the threshold that has been identified by CMS, an important federal study. That's just for basic clinical needs of a nursing home resident. Again, that's 4.1 hours. We're nowhere near that. And finally, we need to make sure that we're including a clear enforcement guidelines with penalties for facilities when they're not complying with nursing home staffing levels. And we don't have that. And so, you know, if you can operate without impunity, you know, you're just not going to have the same results. And we need to make sure that this never happens again. So I'm going to go to my next slide. So let's talk about the repeal of legal immunity. We're very, very pleased that that happened. That's something that AARP advocated strongly for, and we know that it was repealed through a bill and that the governor signed it back in April so that no family member who has lost a loved one due to neglect or abuse has to pursue this course of action. They don't want to do it. It's not the first thing in their minds, but we can't take that last resort away from them. And I'm going to move on to transparency. So we need to make sure that the data that we're collecting on fatalities and infectious diseases in the nursing homes and adult care facilities are publicly available, and we need to have an annual report on that. There is more reporting being done now, and we're very pleased about that. And we're particularly pleased that it's looking at communities of color, because it's really important, because we know that they've suffered even more during these times. But we must have full transparency on the data. You know, we don't know if, God forbid, this pandemic is going to rear its ugly head again, and we don't know the next crisis coming down the road. We have to be ready. The next part is home and community-based services, and I think we heard this again and again. And we're very thankful that the legislature put $15 million into the budget, but that's nowhere close to the $27 million that we asked for that would just eliminate the current waiting lists. So we really need to go back and look at that, because if we are not able to keep people out of nursing homes, you heard Jim say, you know, the big payer is Medicaid, and when Medicaid pays, we all pay, the taxpayer pays. And so we need to be good fiduciary agents of watching that money, of how it comes in. Plus, and you all have heard me say this, God, I'm here 25 years. You've heard me say this many times. We have to respect the wishes of people who we know they want to age in place. And then the next one is a visitation. So in ensuring that there was safe in-person and virtual visitations, this was really important. And also the compassionate care visits. We know so many people lost loved ones and they were not there to be able to comfort them through any kind of media at all, and that was really so sad. So we're taking a big step in that direction. We know that the state has the new bill that May and Bronson put through, which achieves this goal. But I think that we have to remember that this isolation is deadly. It is when you're isolated, it's equal to smoking 15 cigarettes a day. And the heartache that people felt through this, being unable to really monitor how their family members were being cared for, that was a huge loss. And I want to go back to the long-term care ombudsman, because I so appreciated Senator Serino talking about that she wanted the $5 million to go into long-term care ombudsman. And you know what? That's exactly what AARP wanted, and we wanted it desperately. But unfortunately, only $250,000 went in. So we asked for $5 million, we got $250,000. Many of you know, long-term care ombudsman is basically operated through a network of incredible volunteers, and the majority of those volunteers are older people who really felt that they could not go out and put themselves at risk, and the state recognized that and didn't allow them to go in. So what happens next? I know that SOFA and DOH are looking at the future of long-term care ombudsman, and we're anxious to be helpful in that. And I know many of you are also, and we're really glad it's going to get a more serious eye. Okay. And finally, some other achievements we've had this season, which is the governor signing into law the Rivera-Hevesi law in March, which is going to protect the safety of nursing home residents, looking at making sure that all those discharges are safe, and that nursing home residents going back into homeless shelters or other places that are ill-equipped to care for them, we all know that's not going to work, and we're going to have reentry issues. So that's great. And finally, the overwhelming majority of those discharged are, again, people of color. You all might be very aware of the work that we've done on disrupting disparities, looking at all of these impacts of long-term care on communities of color. And there's a lot more work that needs to be done, but we've had great partners moving forward. Really have to call out Greg Olson in this. He's been an incredible partner in looking at disrupting disparities, and I know you're going to hear from him again later. Finally, creating a long-term care task force. So the legislature passed it thanks to May and Cruz in March. It has not been signed by the governor. I need to say that again. The bill has not been sent to the governor, so obviously it hasn't been signed by the governor. So nationally, as I said before, 40% of all COVID deaths in the country happened in nursing homes, and yet they only make up 1% of our population. Again, I'm reiterating here, New Yorkers of color have been hardest hit, both from the respect of being the residents, their families, but also the staff at nursing homes. And that is something that we really have to even be more aware of and understanding infection control. And finally, AARP is looking to work with consumers and long-term care providers and unions, because we know we need to figure out a way to fix our long-term care system. I know that Pierro has been looking at this with Gail for a long time, and many of you in this audience have been looking at it also. New York State has done an amazing job reinventing a lot of things around schools and hospitals. And surely, I think you all agree with us, the long-term care system deserves no less. Now I'm going to get into the Caregiver Tax Credit. So many of you are aware of this, and other legislators are very aware of this. We've been working to get a family caregiver tax credit for a long time. We've been looking at $7,000 a year as the average of what people pay out of pocket. The bill that we have been looking for in New York actually is $3,500, and we really thank Senators May and Assembly Kim for trying to help move this forward. But I want us to take one moment just to talk about the federal legislation that AARP is backing nationally. And I know we had David Goldfarb on earlier, and I'm sure he's looking at this. So there's a Federal Credit for Caring Act that's just been introduced to Congress with help from Representative Reed to help unpaid family caregivers offset $5,000 of out-of-pocket expenses. So we're hoping that that gets put through. Who knows? We know that there are 2.5 unpaid family caregivers in New York State, and we know that they need help. So finally, let's just look at the future. I totally agree with Jim. We need nursing homes. We need strong nursing homes, and they need to get what the resources that they need to make sure that they're operating full safety and also with dignity as people age. So providing that safe, quality, and affordable care, I think we're all in that together. Nursing home employees do heroic work. They did it through the pandemic, but you know what? They didn't do it just during the pandemic. They have done it for a very long time. But so do family caregivers, and they provide $31 billion a year in unpaid care to older New Yorkers every single year. Make no mistake about it, they are the backbone of the long-term care system. And that's why SOFA and DOH have been keeping their eyes on it and are working to improve the systems. And we want to help, and we want to be strong partners to continue to do that, because we have to improve overall long-term care affordability by supporting unpaid family caregivers in New York. People want to age in place. Their families want them to age in place. We have been surveying our members forever, and I can tell you, almost 9 out of 10 say they want to age in their own homes and communities. They built these communities up, and they deserve to stay there. And you've heard me say this before too. They are also the backbone of the local economy. They are the longevity economy. And Greg can also underscore that because he's done some great research in that area. They are the people that when they get their pensions and they get their Social Security, you know, whatever money they have coming in, they're not parking it offshore, folks. They're spending it in their local grocers, bodegas, pharmacies, dry cleaners, you name it, not to mention paying their local real estate taxes. So it's really important that we keep people in place because it's what they want, but it's the fiduciarily responsible thing to do. So I thank you. I'm really looking forward to hearing your questions. Oh, I want to say one more thing. Just a quick tickler. I heard people talking about rural and particular problems about getting home and community-based care in place in rural. I think Lou mentioned it earlier too. So just a tickler for you. Late November, we're going to be doing a summit on disrupting aging in rural communities. So keep an eye out, and hope that many of you will be able to participate in that. And
Thank you,
back
Beth.
to you, Aaron, and thank you.
It's a lot of great information. Unfortunately, we don't have a lot of time for questions. So if you send us those questions, we will get them to Beth and Jim. I just want to briefly ask each of them one question. Beth, one of the things we see is that people want to take time off to care for their job, or care for from their job to care for their parent, or, you know, they're already home, but they can't really make a living wage on what's available. So is there any work being done, and even the people who are working in the nursing home getting, you know, the Medicaid rate of $11.50 or $12 an hour? Is that anything that's being looked at the moment?
Well, I think New York was really a leader at the forefront of passing paid family leave in New York. So there is a mechanism in New York, and we're pretty proud of it because we work pretty hard for it. It's been up in place. I don't know that enough people are aware of it. It's something I can ask all of you to be partners with us and helping to make sure that people are informed about that.
And Jim, we heard Beth mention that the New Jersey legislation, I believe, requires 90% of income essentially to be paid on care. Is that something you would view as viable? That could a facility do that?
Well, it all depends on how you describe what is resident care. So a great example is capital. If I build a beautiful new place, should some of that be counted as resident care? In New York, it's not counted as resident care. So it all goes into what is in the definition. Obviously, you couldn't take New York's definition of resident care and make it 90%. You wouldn't be able to pay, your electric bill or your capital budget or anything else. So if you change the definition, maybe, but it sounds like it's it would have to be a pretty broad definition in order for it to be workable in this state.
Great. Well, I want to thank you both for joining us. We're coming up on our coffee break right now, and we will be back in 5 minutes with the impact of COVID in aging New York. Thank you very much.